Hi everyone, so these are the Chapter 8 key points, and we are going to start with comparing group and individual health plans. So group health plans are established and regulated by an employer, and then employers are going to decide on basic plan coverage and optional riders, eligibility requirements, premiums and deductibles, so on and so forth. Individual health plans provide coverage to those not covered under a group health plan. Individual insurance plans also have pretty basic benefits. So, a couple of things to note here. Many employees have medical insurance coverage under group health plans that their employers will sponsor. Human resources departments manage these healthcare benefits, and they negotiate with payers and then select a number of plans to offer the employees. Both basic plans and riders that employees may buy and add to their policies are going to be offered through these group plans. Riders are also called options sometimes, and they are often offered for vision and dental services. So you can buy your basic or your comprehensive medical plan and then also add on vision and dental insurance as well. So during specified periods, and that usually happens once a year, there's an open enrollment period, and that is when employees can choose the plan that they prefer for the coming benefit period, so for the next year. In individual health plans, those are also available for purchase, and almost 10% of people with private health insurance have these individual plans. So there's not a whole lot of the population that has individual health plans, but some do. People often elect to enroll in individual plans, although coverage is expensive in order to continue their health insurance between jobs, and sometimes that's called COBRA. If they don't use COBRA, then they can use these other individual health plans that are available out there too for gap insurance coverage. So purchasers also include self-employed entrepreneurs, students, recent college grads, and early retirees. Individual insurance plans have basic benefits, and they don't have the riders or additional features that are associated with those group health plans. So next, we're going to differentiate among major private payers. And there are a small number of large insurance companies that dominate the national market in the United States. Those include WellPoint, United Health Group, Aetna, Cigna, Kaiser, HealthNet, Humana, and then Coventry. Blue Cross Blue Shield is a national organization of independent companies and a federal employee program that insures nearly 100 million people. So Blue Cross Blue Shield is pretty hefty in the insurance industry. So a little bit about each of those. Blue Cross Blue Shield has both for-profit and non-for-profit members, and it's actually not a payer, it's an association of more than 40 payers. WellPoint.
Sorry,
that was my Siri picking me up. So WellPoint is the nation's largest health insurer in terms of enrollment. It is also the largest owner of Blue Cross and Blue Shield plans. United Health Group is another large health insurer that runs plans under its United Healthcare subsidiary, and also owns other major regional insurers. Aetna has more than 44 million members, and it has a full range of products including healthcare, dental, pharmacy, group life, behavioral health, disability, and long-term care benefits. Cigna is a large health insurer with strong enrollment in the Northeast and in the West. Kaiser Permanente is the largest nonprofit HMO. Kaiser Permanente is a prepaid group practice that offers both healthcare services and insurance in one package. It runs physicians groups, hospitals, health plans in the Western, Midwestern, and Southeastern states, plus Washington, D.C. Everybody around here knows Kaiser to be a pretty substantial player in healthcare around here. Then we have HealthNet, and that operates health plans in the West and has group, individual, Medicare, Medicaid, and TRICARE programs. Humana is a particularly strong in the program that's in the South and Southeast. It offers both traditional and consumer-driven products. Humana handles TRICARE operations in the Southeast also. Coventry Health is a national managed national managed healthcare company that's based in Bethesda, Maryland, operating health plans, insurance companies, network, rental and managed care services companies, and workers' comp services companies. It provides a full range of risk and fee-based managed care products and services. So that's just a little bit about some of those different insurance companies. So let's take a look at how we're going to support billing decisions using payment and billing guidelines. So the insurance contracts are evaluated to determine if participation will be financially beneficial to a physician's practice. Because if we're not making any money, it doesn't really do us any good to participate in the insurance contracts. Contract rules that must be followed specify the physician's responsibility as a participating provider and also the plan's responsibilities toward the participating provider. Managed care contracts outline compensation and billing guidelines that include the fees that can be charged by the provider, the billing rules, and then the patient's financial responsibilities. So you can read a little bit more about that information under section 8.3 in your text. Next, a couple of things to note about preparing accurate private payer claims. Claims are prepared in accordance with the payer's billing and claims guidelines. So that's with the insurance company that you're contracted with's billing and claims guidelines. You want to make sure that you indicate group on the claim form if the patient is covered by an employer-sponsored plan, and indicate other if the patient is covered by an individual health plan. Okay, so how to manage billing for capitated services. Insurance coverage must be verified before services are provided to patients enrolled in capitated plans. Regular services provided under the plan are written off, and services not covered by the capitation rate can be billed to the patient. So a couple of things to note here. When the practice has a capitated contract, careful attention must be paid to patient eligibility, referral requirements, encounter reports, claim write-offs, and billing procedures as well. As far as patient eligibility goes, under most capitated agreements with primary care physicians, providers will receive monthly statements that cover the patients who choose them as their primary care providers for that month. The monthly enrollment list that the plan sends with the payment should list the current members. This list is also called a provider patient listing or a roster, and that's going to contain the patient's names, their identification numbers, dates of birth, the type of insurance plan or program that they are enrolled in, and then an effective date of registration for that primary care physician or provider so that they know when they chose that provider as their primary care. At times, though, the list is not up to date, so in order to be sure that the patient is eligible for service, the insurance coverage always has to be verified. An HMO may require a primary care provider to refer a patient to an in-network provider or also to get authorization from the plan so that they can refer a patient to an out-of-network provider. So just a couple of things to note there about billing for capitated services. Okay, so those Blue Cross Blue Shield forms are in Connect and assigned to you for the week. Please make sure that you complete those. And that is it for Chapter 8.